From the News Channel 5 Network, this is OpenLine.
And good evening and welcome into OpenLine. I'm Chuck Long, going to be along with you for the next hour. Tonight is Ask the Expert, and this is where we're going to be asking the expert in endodontist. We're going to be talking about root canals in your teeth and how to save them and the myths that surround your teeth, and so many questions and comments that I know you're going to have throughout the hour. Our special guest, one of our most popular, and we always look forward to him being here, Dr. Richard Horwat. Great to see you, Dr. Horwat.
Thanks. Nice to be here.
You know, one of the things when we're talking about teeth. Oh, and I did want to mention too, don't forget, you can call us at any time. 737-7587 is the number. It's right there on your screen when you do have a question or comment. But you know, when it comes to teeth, I think, and we'll talk a little bit later too about some of the myths that people have and misconceptions, but people sometimes don't know when to go see the dentist, when to see the endodontist, that kind of thing, what you should do. So we're going to talk about a lot of this throughout the hour. But one of the things that I know that people obviously are going to go see the endodontist about is a root canal. So kind of tell me the concept, root canal, how it's changed, how it's improved through the years.
Well, technology has advanced. You know, nowadays, a while back, a lot of general dentists were doing root canals. I think a lot of them are still doing root canals, but I think that now with the technology, with cone beam x-rays, they're finding out that they might be a little bit more involved than they had once thought. I know that one of the nerves in there on what we call an upper first molar tooth, there's usually an extra nerve in one of the roots. I know that even when I did general dentistry, I very rarely found that nerve. 90% of the time it joined another nerve anyways, so it was pretty much irrelevant. Now that I'm doing endodontics, we do every case under a microscope. I find that nerve about 100% of the time, just about. So it's changed in that regard as well. We do a lot more retreatments than a general dentist is going to do as well, so that's, you know, I think that just the technology as it advances over time, you know, as with any profession, it just progresses over time. We use different chemicals, different studies will come out, things are time tested. Sometimes they'll come out with a newer product or a newer, the greatest thing, and then over about 5 or 10 years they'll say, hey, maybe this wasn't so good, and then they go back to an older technology and stuff like that. But when you go to a specialist, we usually stay current with the literature, and we try to stay modern.
And in a normal situation, someone would go to the dentist, and the dentist would look, and if, for example, they needed a root canal, then they refer them to the endodontist. True,
they do. They refer them to us. You know, sometimes they just cut to the chase. A lot of times in a general dentist, their schedules are pretty busy. You know, there's a larger demand out there for that, and a lot of times the patient will give them a call and they're already in pain. And working a patient that's in pain into a busy schedule can be tricky sometimes, and we're usually able to better accommodate that. And so they'll usually give us a call and ask if they can send them right on over, and we usually take care of them.
And what are some of the reasons that someone would visit the endodontist?
There's different reasons. You know, there's different reasons why people need a root canal. I would say most of the time it has to do with the patient's uncomfortable in a tooth. Oftentimes they can't figure out which tooth it is. They just know they're having pain over here, and we're able to go through different clinical tests, and we're able to isolate which tooth is causing them the discomfort. But sometimes, you know, in those particular cases, the nerve's inflamed, and when you have an inflamed nerve that's causing discomfort, you want to get that inflamed nerve out of there. Other times, you have a patient, they might not have any symptoms at all, but they'll go to their general dentist, they'll pull out x-rays, and they'll find a lesion on the x-ray. And we know that we need to get that dead nerve out of there, even though it's not causing discomfort. The bacteria is there, it's just dormant. And when the right stimulus comes along, and it wakes up, it's going to let them know about it, and it can put them in the emergency room. It can be life-threatening, and we want to make sure that we get that dead nerve out of there. So sometimes patients come because they're in pain. Sometimes there's no pain at all, but they have a lesion or they have an infection.
Well, and I think that's one thing that people sometimes are a little confused by, that they need a root canal, but they don't feel any pain, there's no discomfort and that sort of thing. But as you were just saying, that's not always the case. You could need a root canal and not even realize it.
We get that every day. I had a patient today, they had 2 teeth. They had a bridge, a 3-unit bridge, and both teeth had very large infections. The patient was pretty adamant in telling me that they didn't want to have the procedure done. And you know, my job is to tell them what they should do. They're the boss. They're welcome to proceed however they feel is in their best interest. But me doing my job, I'm showing them they have the infection. I'm showing them where it is, and I'm letting them know the risks, the alternatives, the benefits. to treating it and not treating it. And of course, I'm recommending treatment. But yeah, we get that all the time. The patients just told me they had to bridge for 10 years. They've never had symptoms. But it was in their best interest to get the root canal.
Now, what about, and I know as you're watching out there, and maybe you're tuning in for the first time on this particular segment on endodontics and that sort of thing, and you're thinking, if I need a root canal and I have caps or I have veneers, something like that, what is the process? Is it going to ruin the veneer, that kind of thing? So how would you answer that?
Veneers are a little bit more tricky than crowns. We go through crowns every day as well. You know, a patient, a gentleman had asked a couple episodes ago whether or not every tooth that is crowned needs to have a root canal prior. And the answer to that is no. It doesn't have to. Every tooth that's root canal, almost every tooth should be crowned. But oftentimes a general dentist will want to be conservative, and they'll want to go ahead. The patient's not having any symptoms, but they get to a point where the tooth is better restored with a crown restoration as opposed to a filling for multiple different reasons. But over time, again, you know, an abscess can develop, or that tooth after it's crown prepared can be symptomatic. If they already have the crown on the tooth, we usually just make a very conservative access hole through the crown, and we just do the root canal by that method. And then we just kind of backfill it, and we're able to fill it up and restore the tooth. It's back to normal.
Now, like with cavities, that's sometimes obvious. Someone's thinking, well, you know, I've got a cavity, or I haven't brushed enough, I haven't flossed, and that sort of thing, or different causes for problems with, you know, your teeth and that kind of thing. What are the causes? What are the things that lead to needing a root canal?
Well, oftentimes if a patient has a lot of decay on a tooth, we get this all the time as well. You can look at an x-ray, you can see the cavity going into the nerve. And even though the patient may not be symptomatic right now, we know that when we remove that cavity, we'll either be in their nerve, and they'll definitely have discomfort then, or it's going to be so close to the nerve when they remove that cavity that it's going to cause them discomfort. A lot of times when you have that giant cavity there, depending on how big it is, we can kind of look at it, and we know that if they're not uncomfortable, we know that the tooth is probably dead already at that particular stage, and we'll go through the testing just for diagnostic purposes. But we can generally look at something. I would say that most of your dentists that have been doing this for it doesn't take long. You know, you get out of school, you might be a little bit more conservative, but after a while, and after you've done this for about a good little while, most of the dentists can kind of look at the x-ray, and most of the times can kind of tell that this is probably going to need a root canal once they go in there and try to excavate that cavity.
Okay, and again, as you are watching, you may be thinking about different things that are going on with your teeth. You know, a lot of times someone might have a chipped tooth, and it might just be a barely chipped tooth, or it might be a little bit more severe, that kind of thing. Mm-hmm. What would you recommend when someone has chipped tooth? Do you get it fixed immediately?
Well, obviously, if you chip a tooth, you know, even if it's a small chip, likely there's going to be some exposed nerve endings in there. And oftentimes, it depends on the extent of the fracture, of course. If it's just through the enamel, the outer surface of the tooth, you know, of course, they can just repair that. But even that might be a little bit tender. I mean, the trauma involved in a chip alone is going to probably cause you discomfort, at least for a few days. If you do chip your tooth, you should go to the general dentist. That way we can kind of assess what's going on, and we can figure out what's in your best interest. More times than not, assuming that depending on the extent of the fracture, oftentimes they can just put a restoration on there and you'll be just fine.
Okay.
But it depends on the extent of the fracture, of course.
All right, so again, visit the dentist, visit the endodontist, and kind of, yes, always. All right, we're going to the lines right now. As always, you can call us at 737-7587 with questions, with comments. Peter is on the line with us right now. Peter, do you have a question or a comment for Dr. Horwat?
Yes, I had a question about brushing your teeth too hard. I was told I'm getting some sort of receding gum lines and damage because I was brushing too hard with using an electric toothbrush. And I didn't know if the electric toothbrush is truly the problem there, or if it's just if I'm putting too much pressure, and if I should just change to a normal toothbrush, and how can I fix that problem of brushing too hard?
Well, first off,
a good question.
Yeah, it is a good question. I think that when it comes to electric toothbrushes and regular toothbrushes, I think that whatever's going to motivate you to brush your teeth, that's what you should use. I'm not very passionate about one product over another. I will say, though, that I do think that a lot of people are using the electric toothbrushes, and they're adamant about it. They think that it's saved their lives with regard to brushing. You only want to use a soft toothbrush first off. I wouldn't recommend using anything hard or even medium. I don't think there's any use for them in your mouth, personally. And your general dentist can kind of go over the details with you with regard to how you should be brushing. But generally, you do want to massage your gums to some degree. I'd have to watch what you're doing to know to be able to give you any type of specific answer of what you could be doing wrong. But you do want to stay away from anything that's hard, and you definitely don't want to be too aggressive with it. You know, depending on the location of the mouth you're brushing I would be able to tell you what type of technique would be best for you, but it really kind of depends.
Okay.
But I think that if you're using the electric and it's motivating you to brush, I think it's great. I don't think you need to stop using your electric. I'd be surprised if that specifically is what's causing your gums to recede. You know, as you age and go through the aging process, your gums are always going to recede a little bit over time anyway, just from wear and tear and from use. So you need to keep that in mind as well. When your gums recede too, you're exposing a different type of tooth structure. What you can see in your mouth is generally the enamel or the crown of your tooth, the anatomical crown of your tooth. Once your gums recede, you're now digging into an area called cementum. That's your root structure, and it's a bit softer than your enamel. So you need to keep that in mind. And when you are brushing and you are getting older, those areas can wear down. And over time, you can develop a lesion that we like to call it an abfraction. Describing what an abfraction, it might be a little bit too technical to get into what it is, but it looks like you have a kind of a dent in your tooth. And once you have that, it's pretty hard to fix it. Your best option is to pretty much leave it alone until you have to fix it. But I would just recommend, if you think that that's not doing it for you, you think it may be causing it, you might want to consider going to a soft toothbrush and just doing things manually. That way you can have a little bit more control over what you're doing.
Right, makes sense. Good advice. All right, Peter, thanks so much for calling in this evening. If you would like to call in, as always, that number is 737-7587. It is Ask the Expert Night. We are talking to endodontist Dr. Richard Horwat. He's here for the entire hour, so when you have those questions or comments, just go ahead and give us a call. We'll get to as many as we can this evening. Right now, though, we are going to take a break. We'll take more calls when we come back here on Open Line.